Hello everyone, so welcome to another video. So today we'll be looking at cholera. And cholera is a very common infection, and it is basically an acute diarrheal illness that is caused by an infection with a particular bacteria known as Vibrio cholerae. So it usually leads to rapid loss of fluids and electrolytes through having severe watery diarrhea, which can cause dehydration, and it can cause death within hours if it's not treated properly. So looking at the background of this condition known as cholera, so cholera remains a significant public health issue, a significant public health threat in regions where there are poor water sanitation and hygiene, especially in rural areas where there's limited access to clean water and the hygiene is just really not very okay. So this cholera, it usually spreads quickly during outbreaks, especially in areas affected by natural disasters, displacement, or conflict, like areas that is experiencing war basically. So the disease is primarily transmitted through the ingestion of food or water, so it's fecal oral, and it's basically transmitted through the ingestion of food or water that has been contaminated with human feces that contain this bacteria Vibrio cholerae. So looking at the signs and symptoms, so there's usually a sudden onset of profuse watery diarrhea. So it's often described as a rice water stool. So this is the main sign of cholera. So we have watery diarrhea, then accompanied by vomiting. There could be muscle cramps due to loss of salt, loss of electrolytes, then rapid heartbeats, thirsty and dry mouth, reduced skin sugar due to the skin losing its elasticity, then presence of sunken eyes, then low blood pressure, sometimes confusion, dizziness, because you are losing a lot of electrolytes from the body, you are losing a lot of water from the body. So the body is in a state of disarray, and sometimes there could be fainting in cases of severe dehydration which could occur. And then usually with cholera there's absence of fever in many cases. So looking at the clinical presentation, patients may arrive at the hospital or the pharmacy severely dehydrated, especially if they've had several hours of diarrhea without having fluid replacement. So they've lost a lot of water, they've lost a lot of electrolytes, and they are basically going to look severely hydrated with sunken eyes, with looking like they just, I don't even know how to explain it, but just looking like they've lost a lot of bodily fluids, a lot of things that the body needs. So the patient's skin, it may sometimes appear wrinkled, and they may be weak or lethargic. And then in children, symptoms may include irritability, drowsiness, and soft spots on the head. So looking at the etiology, like I said in the beginning, the disease is caused by an ingestion of the bacteria Vibrio cholerae, particularly serotypes O1 and serotypes O139. So the bacteria produces a toxin that stimulates the intestines to release large amounts of water and salts, leading to the hallmark watery diarrhea. So this watery diarrhea is caused because the bacteria is releasing its specific toxin that particularly attacks the intestines. So looking at the risk factors, number one, drinking unclean or contaminated water, contaminated food, eating raw or uncooked seafood, roadside food, because we most of the time eating, in fact eating out is a risk factor on its own, because we don't know how, whenever we eat away from our home, we don't know how this particular foods they are prepared. We don't know where they are taken to. We don't know how they are stored. We don't know anything, like what has even perched on the food or anything. So particularly eating outside is a risk factor on its own. So also living in areas with poor sanitation, or traveling to areas of poor sanitation, or traveling to areas with the outbreak of cholera already. So also not washing hands before eating, or not washing your hand after using the toilet. I don't even know how someone even not washing your hand after. Let me not start about that. Then overcrowded settings too, such as refugee camps. Refugee camps are always very packed, always overcrowded. So because of this, it's easy to transmit different things, different infections. Then having a weakened immune system or being malnourished is also a risk factor, because once you have a weakened immune system, your body does not even have anything to fight, doesn't even have the strength to fight off infection. Any small thing, you're carrying it. If there's malaria, you're carrying it. If there's anything, you're just carrying it. So having a weakened immune system is a major risk factor. Then looking at the anatomy and the physiology. So this Vibrio cholerae, this bacteria, it primarily colonizes the small intestine. So it adheres to the epithelial cells and it releases the cholera toxin. So this toxin increases intracellular cyclic adenosine monophosphate, which is a signaling molecule. So this signaling molecule, it interferes with the sodium and chlorine transport systems of the intestinal cells. So it usually leads to massive outpouring of water and electrolytes into the intestinal lumen. So now looking at the pathophysiology. So this cholera toxin, it triggers chloride secretion and inhibits sodium absorption in the intestinal cells. So this imbalance, it draws water into the intestines, resulting in a voluminous watery diarrhea. So the fluid loss can be high, as high as 1 liter per hour, which could cause a rapid dehydration, can cause metabolic acidosis, and it can also cause shock if left untreated. So for the diagnosis of this cholera, usually it's clinical suspicion based on the person's symptoms, especially based on this watery diarrhea, and based on the setting too. Like if you are in a place where there's an outbreak of cholera and you are having specific symptoms, they would actually suspect that you have this cholera, because it's what is rampant in the areas of that time. So also stool culture, doing a stool culture is usually the gold standard to confirm the presence of this Vibrio cholerae. Then rapid diagnosis tests, they can detect antigens in stool, which is useful during outbreak situations. Then assessment of dehydration severity is crucial for management of the symptoms, like assessment of how far the dehydration has gone, whether it's mild, moderate, or severe. So looking at the differential diagnosis, another condition that could mirror the same symptoms as cholera, typhoid fever, because the bacteria too is targeting the intestines. Then food poisoning, especially from salmonella, shigella, then giardiasis too. Then there's something called enterotoxigenic Escherichia coli infection. So basically, infections that target the intestine too could mimic the same symptoms as this cholera. So looking at the management or the approach considerations for this condition, first we have to give the person fluids and electrolytes. like giving the person oral rehydration solutions, ORS, is usually the cornerstone for treatment for mild to moderate dehydration. Then in severe cases, we have to give intravenous fluids like Ringer's lactate, and is usually used to rapidly restore the hydration of the patient. Then antibiotic therapy. So usually antibiotics are not always necessary, but they are recommended in moderate to severe cases to reduce the duration and the severity of the illness. So commonly used antibiotics, for example, doxycycline, azithromycin, ciprofloxacin, depending on the local resistance patterns. So those are the commonly used antibiotics for this cholera. Then zinc supplementation too is necessary, because zinc helps reduce the duration and the severity of diarrhea in children, and it also supports intestinal healing. So giving children pediatric zinc it's a good way to manage their symptoms. Then nutritional support to, like, especially if this cholera is occurring in children. So if it's occurring in like babies, now continue breastfeeding or feeding them their usual foods during and after illness. And then for general infection control and public health measures, so improving sanitation, that's providing clean water, proper sewage disposal, promoting proper hand hygiene, regular washing of the hand with soap when after eating and after using the toilet. Then educating communities, like doing different campaigns, doing different conferences to just educate the community about the safe use of food and water. And then vaccination too. So oral cholera vaccines, they can help to control outbreaks and protect at-risk populations. So finally, looking at the prognosis, so with prompt and adequate rehydration, the fatality of cholera is less than 1%. And then without treatment, the mortality rate can exceed 50% due to shock, multiple organ failure, which can occur from severe dehydration. So early intervention and public health responses can significantly reduce the mortality rate and limit outbreaks. So basically, with cholera, once you're able to handle the dehydration and supplement the lost water and the electrolytes, the patient is basically has a better chance of survival than just when the condition is not treated at all. So that is a breakdown of the condition known as cholera. Thank you.